is Ju-Shin Chang, and for this research presentation, I'm going to talk about coronavirus disease.
The severe special infection phenomena epidemic is a acute phenomenon, and is pathogenous new coronavirus that has not been previously found in human bodies. It first discovered the symptom in Wuhan, China at the end of 2019. Subsequent patients mostly had a history of exposure to the South China seafood market or cluster phenomena, making Wuhan, China the first city to be affected by the disaster. The third source of infection is still unclear. Because the virus spread too suddenly and quickly, the virus began to invade the country in early 2020. Most human infections of COVID-19 are mainly caused by respiratory symptoms, including nasal congestion, runny nose, cough, fever, and other general upper respiratory infection symptoms. Although the transmission rate of COVID-19 is not yet fully understood, it is known from case investigation and experimental studies since the global diagnosis that the disease is mainly infected by direct or indirect means of droplet transmission and contact transmission. According to the analysis and investigation of experts, this virus can be subdivided into alpha, beta, gamma, and delta coronavirus. COVID-19 has become one of the most severe viruses in history since it spread in 2019, and public health is now more important than ever to drive the entire world to slow down the spread of the virus. People cannot only rely on the government to peripheral control of COVID-19, but need to strengthen the prevention of the virus and slow the spread of the virus through their usual daily hygiene methods such as wearing masks, washing hands, and disinfecting. When the people and the government thoroughly understand the importance of public health and have a stronger sense of self-protection, people can relatively reduce the weight and risks of COVID-19 transmission. COVID-19 since 2019. The number of confirmed cases worldwide has reached approximately 181 million, and the global death toll has reached 3.91 million. The United States has become the country with the largest number of confirmed cases globally, with the number of confirmed cases reaching 33 million and a mortality rate of 1.8%. The world's second largest number of confirmed cases in India, with a confirmed number of up to 30 million and a mortality rate of 1.31%. In a European clinical trial survey report on 1,420 patients with mild to moderate new coronary phenomena, these patients were roughly 20 to 50 years old, and their incidence of common symptoms of COVID-19 is divided into headache, loss of smell, nasal congestion, cough, fatigue, myalgia, runny nose, taste dysfunction, sore throat, and fever. From Statistic Age Death Analysis Survey, it shows that the probability of a confirmed death over the age of 90 was 27.9%. The 60 to 69-year-old mortality rate is 2.8%. The survey shows that the mortality rate of COVID-19 will be affected by age. Due to aging, the body immune system will be weaker than the resistance of young people, and the aging of organ function will cause the death rate of elderly to occupy the highest position. From the survey of gender, the fertility rate of Chinese men, 2.8%, who are diagnosed with COVID-19 is higher than women, 1.7%. In the United States, 57% of deaths caused by COVID-19 are men. From the rate of gender, the mortality rate of men with COVID-19 is higher than that of women. According to the investigation, when looking at biological factors, the female chromosome have higher immune-related genes. Furthermore, when looking at the analysis of personal behavior factors, men's drinking and tobacco use are often higher than women, leading to higher infection and higher mortality. The spread of COVID-19 has caused many people to lose their job and financial ability. Among them, education level has the greatest impact on high school or less. From the above survey, the employment rate for high school or below is twice as high as for those with a bachelor's degree, indicating that COVID-19 will have different effects depending on the level of the education. At the beginning of 2020, medical teams and public health agencies in various countries have already understood or confirmed that COVID-19 could be infected from the human mouth, nose, or respiratory tract by close droplet and close contact. Therefore, in the absence of vaccine, public health primary epidemic prevention strategy is to wear masks correctly, whether in a restaurant or on airplane, trains, and other transportation. According to the CDC, the barrier of masks can prevent droplet from yourself or others from spreading to the respiratory tract. The wearing method and type of mask also have a specific regulation. Medical masks approved by the Department of Health, or masks with 2 or 3 layers can effectively reduce the chance of direct infection. Second, people must keep a safe distance for 6 feet away from other people. Even if people wear masks, the social distance rules do need to be maintained. Next, it is necessary to have certain hygiene consent and habits, such as diligent hand practice, using at least 60% alcohol disinfectant to clean any high content item. After mid-2020, vaccines in various countries have been developed one after another. At present, the main propaganda of each country and the basic concept of epidemic prevention and hygiene is to hope that people can actively get vaccine. Vaccination can improve human immunity to COVID-19 and at the same time can reduce the side effect of the infection person. The protection of vaccine can at least temporarily help humans face the current invention and treatment of COVID-19. In addition to this hardware protection measure, the entry regulation of many countries now require 14-day quarantine at an epidemic prevention hotel and a negative test before they can truly enter a country. Many pharmacies also provide free inspection stations so that people can quickly inspect and analyze their health condition. A third new variant of the Delta virus has spread. If people can continue to adhere to these epidemic prevention measures and habits, the life of COVID-19 is only a matter of time. It has been more than a year since the spread of COVID-19, and countries are still working hard to maintain public health order. Although this virus has harmed the ordinary lives of more than tens of thousands of families, the death toll has risen to as much as 3 million. But because of everyone's effort and support, especially the many contributions of public health, people can learn and understand the usual basic hygiene concept to protect themselves and others in this epidemic. Although the virus has not yet been entirely resolved and eliminated, the outbreak of COVID-19 has made people pay more attention to the importance and necessary of public health to break through the invasion of the virus. And here is my reference. Thank you for listening.